Maria Santos had always been the kind of person others barely noticed. At 42, she worked as a night janitor at the downtown medical center, her small frame moving quietly through empty hallways while the rest of the city slept. Her coworkers knew little about her beyond her punctual attendance and the way she never complained, even when asked to cover extra shifts. The morning everything changed started like any other. Maria was finishing her rounds in the pediatric wing when she heard crying from one of the patient rooms. Inside, she found 8-year-old Tommy Williams sitting alone, tears streaming down his face. His mother had stepped out to speak with doctors about his upcoming surgery, and the boy was terrified. Without hesitation, Maria sat beside his bed. In her gentle voice, she began telling him stories about brave children she had known. Weaving tales of courage and hope, she stayed with Tommy until his mother returned, her presence bringing peace to the frightened child. This simple act of kindness would soon set in motion events that would change everything. Dr. Rebecca Martinez, the head of pediatric surgery, had been watching from the doorway. She was impressed by Maria's natural ability to comfort the child. But what caught her attention even more was the way Maria moved. Despite her caring demeanor, there was something stiff about her posture, a careful precision in how she sat and stood that spoke of hidden pain. Over the following weeks, Dr. Martinez began paying closer attention to Maria. She noticed how the janitor would pause sometimes, her hand pressed briefly to her lower back. She saw the way Maria would grip the mop handle tighter when bending to clean low surfaces, and how she sometimes had to steady herself against the wall when standing up from crouching positions. The other staff members had grown accustomed to Maria's quiet efficiency. To them, she was simply part of the hospital furniture, someone who kept their workspace clean without drawing attention to herself. They saw her limp slightly on particularly long nights, but assumed it was just fatigue from hours of physical work. None of them imagined the true story behind her careful movements. Maria had learned to hide her pain well. She had developed strategies over the years, timing her breaks around when the corridors would be empty, so no one would see her struggle to straighten up. She carried ibuprofen in her pocket and had memorized which water fountains were at the perfect height to avoid additional bending. Her life had become a carefully choreographed dance around her limitations. The hospital's head administrator, Mr. Patterson, was known for his efficiency-first approach to management. He had been reviewing staff performance and noticed that the night cleaning crew seemed to be falling behind on their schedules. He began conducting surprise inspections, timing how long various tasks took to complete. When he noticed Maria took longer than the other janitors to finish certain areas, he made a note in her file about potential productivity issues. Dr. Martinez witnessed one of these evaluations. She watched as Patterson criticized Maria for being slower than her colleagues, his voice sharp with impatience. Maria stood quietly, accepting the reprimand without explanation or excuse. She simply nodded and promised to work faster, never mentioning the chronic pain that made every movement deliberate and careful. That night, Dr. Martinez stayed late to observe Maria's work routine more closely. What she saw amazed her. Despite the obvious physical difficulty, Maria's attention to detail was extraordinary. She cleaned areas that others rushed through, ensuring that every surface in the pediatric wing was thoroughly sanitized. She moved slowly, but her work was meticulous and thorough. Dr. Martinez also noticed something else. Throughout the night, Maria would quietly check on patients who seemed restless or afraid. She would adjust a child's blanket, whisper comforting words to a crying toddler, or simply sit for a moment with children who couldn't sleep. The nursing staff had grown to rely on these small acts of kindness, though they never officially acknowledged Maria's contributions to patient care. The breaking point came on a particularly busy Friday night. The hospital was short-staffed due to a flu outbreak among the cleaning crew, and Maria was asked to cover 3 floors instead of her usual 2. She accepted without complaint, as she always did, but the additional workload pushed her body beyond its limits. By 4 in the morning, Maria was struggling to maintain her composed facade. Each step sent sharp pains through her lower back and down her legs. Her hands shook slightly as she gripped her cleaning supplies, and sweat beaded on her forehead despite the cool hospital air. Still, she continued working, determined not to let down the patients and staff who depended on clean, safe facilities. Dr. Martinez was finishing up paperwork in her office when she heard a crash in the hallway. She rushed out to find Maria collapsed beside her cleaning cart, unable to stand. The janitor's face was pale with pain, but her first words were not about her own condition. Instead, she asked if she had made too much noise and whether she had disturbed any of the sleeping patients. As Dr. Martinez knelt beside Maria, she noticed something that made her heart skip a beat. Partially visible beneath Maria's uniform shirt was what appeared to be scarring, the kind that spoke of serious trauma or surgery. The pieces of a larger puzzle began forming in the doctor's mind. But the immediate concern was getting Maria the medical attention she clearly needed. The emergency room staff treated Maria with professional efficiency, but there was an underlying assumption that she was simply an overworked cleaning lady who had pushed herself too hard. They recommended rest, prescribed mild pain medication, and suggested she might want to consider finding less physically demanding work. None of them took the time to really examine her history or understand the full scope of her condition. Maria lay on the hospital bed, staring at the ceiling she had cleaned countless times. She thought about calling in sick for the first time in 3 years, but worried about letting down her co-workers, who would have to cover her responsibilities. She thought about the children who would miss her quiet presence during their darkest hours, and about the night shift nurses who had come to depend on her extra attention to detail in the pediatric wing. Dr. Martinez returned after her morning rounds to check on Maria. She found the janitor trying to discharge herself, insisting she felt well enough to work her next shift. The determination in Maria's eyes was unmistakable, but so was the pain she was trying to hide. Dr. Martinez made a decision that would change both their lives. She asked Maria to stay for additional observation, not because of her immediate injury, but because she suspected there was much more to discover about this remarkable woman who had been hiding in plain sight. As she reviewed Maria's employee file, Dr. Martinez realized how little anyone actually knew about their dedicated night janitor. The file contained only basic information. Maria Santos, age 42, employed for 3 years, excellent attendance record, no complaints from supervisors. There was no mention of her previous work history, her educational background, or any family information. It was as if Maria's life had begun the day she started working at the hospital. Dr. Martinez decided to dig deeper. She contacted Human Resources and discovered that Maria had listed no emergency contacts and had declined the hospital's health insurance benefits, stating she had coverage elsewhere. Her address was a small apartment in one of the city's more affordable neighborhoods, and her references were from temporary employment agencies rather than long-term employers. As Dr. Martinez gathered this information, she began to form a picture of someone who had deliberately chosen to remain invisible. Someone who had reasons for keeping her past private. The careful way Maria moved, the expertise with which she handled medical equipment during cleaning, and her natural ability to comfort patients all suggested a background that extended far beyond janitorial work. The next evening, Dr. Martinez made an unusual decision. Instead of going home after her shift, she returned to the hospital to speak with Maria privately. She found the janitor back at work despite her injury, moving even more carefully than usual, but refusing to take time off. The sight reinforced Dr. Martinez's growing conviction that there was much more to Maria Santos than anyone realized. Their conversation that night would be the beginning of a revelation that would shock everyone who thought they knew the quiet woman who cleaned their halls. But for now, Maria continued her work in silence, carrying secrets that would soon transform how an entire hospital community saw strength, sacrifice, and the true meaning of service. Dr. Martinez approached Maria carefully that evening, sensing the walls the janitor had built around her personal life. She began with simple questions about how Maria was feeling after her collapse, but gradually steered the conversation toward her background and experience. Maria's responses were polite but guarded, offering little information beyond basic pleasantries. However, something shifted when Dr. Martinez mentioned her concern about Maria's obvious knowledge of medical equipment and procedures. She had noticed how Maria handled delicate instruments during cleaning, how she knew to avoid certain areas during specific treatments, and how she seemed to understand medical terminology that most cleaning staff would find unfamiliar. Maria's hands stilled on her mop handle. For a long moment, she stood silent, her eyes fixed on the gleaming hospital floor. When she finally spoke, her voice was barely above a whisper. She told Dr. Martinez that she had once been a nurse, but that was a lifetime ago, in another country, in circumstances she preferred not to discuss. Dr. Martinez felt her intuition had been correct, but she sensed there was much more to the story. She gently encouraged Maria to share more, explaining that she had noticed Maria's natural way with patients and her evident medical knowledge. Slowly, piece by piece, Maria began to reveal the truth she had kept hidden for so long. Maria Santos had not always been a hospital janitor. 15 years earlier, in her home country of Colombia, she had been Dr. Maria Elena Santos, a trauma surgeon specializing in emergency medicine. She had worked in some of the most dangerous regions of the country, treating victims of violence, accident survivors, and anyone else who needed immediate medical intervention. Her specialty had been combat trauma and emergency surgery. She had worked in field hospitals, temporary clinics, and understaffed emergency rooms where she was often the only surgeon available for hundreds of miles. Her skills had been legendary among her colleagues. Her ability to save lives under impossible circumstances, earning her respect throughout the medical community. Dr. Martinez listened in amazement as Maria described performing surgery by generator light during power outages, treating multiple gunshot victims simultaneously, and working 72-hour shifts when natural disasters overwhelmed local medical facilities. The quiet janitor she thought she knew had once been one of Colombia's most skilled emergency surgeons. But Maria's story took a darker turn as she explained why she had left her medical career behind. She had been working in a rural clinic when armed conflict erupted in the region. The clinic became a target because it treated anyone who needed help, regardless of their political affiliations or involvement in the ongoing violence. One night, Maria had been in the middle of surgery when explosions rocked the building. Shrapnel from a mortar round had torn through the operating room, severely injuring her lower back and legs. 3 patients died in that attack, along with 2 nurses who had become like family to Maria. She survived, but her injuries were severe enough to end her surgical career. The trauma to her spine had left her with chronic pain and limited mobility. More devastating than the physical injuries, however, was the emotional toll of losing colleagues and patients in such a senseless way. Maria had spent months in recovery, both physical and psychological, wondering if she would ever be able to help people again. Dr. Martinez began to understand the careful way Maria moved, the strategic planning behind every motion. The former surgeon had learned to work around her physical limitations, but she had never stopped caring for people. Her transition to janitorial work was not a step down in her mind, but rather a way to continue serving in the only capacity her damaged body would allow. Maria explained how she had immigrated to the United States, leaving behind her medical credentials, her reputation, and her entire professional identity. The process of getting her medical degree recognized and her credentials transferred seemed impossible given her physical limitations and the complexity of international medical licensing. She had felt that starting over as a doctor was beyond her reach. Instead, she had chosen work that allowed her to be around medical care again, even if only on the periphery. The night shift suited her because it required less physical stamina than day work, and the hospital environment gave her a sense of purpose and connection to the healing profession she had loved so deeply. Dr. Martinez was stunned by the revelation. She began to see Maria's work in an entirely new light. The meticulous attention to detail, the instinctive knowledge of medical protocols, the natural ability to comfort patients. These were not coincidences, but the continued expression of a lifetime dedicated to healing. As their conversation continued, Maria shared more about her nightly routines. She explained how she had learned which children were frightened of the dark and would quietly check on them during her rounds. She knew which patients had difficulty sleeping and would time her cleaning to avoid disturbing their rest. She had memorized the schedules of different medications and treatments, ensuring her work never interfered with patient care. Dr. Martinez realized that Maria had essentially been providing unofficial patient support for years, using her medical knowledge to enhance the care environment even while officially working as cleaning staff. The former surgeon had found ways to continue healing people, even though she could no longer operate or practice medicine formally. The conversation revealed something else that amazed Dr. Martinez. Despite her chronic pain and physical limitations, Maria had never missed a day of work in 3 years, except for scheduled vacation time. She had worked through illness, during severe weather, and even on holidays when other staff called in sick. Her dedication was absolute and uncompromising. Maria also revealed her financial situation, which explained why she continued working despite her obvious pain. She was supporting not only herself but also sending money to family members still in Colombia, including paying for her elderly mother's medical care. The janitorial job, while physically demanding, provided steady income and minimal health benefits that she desperately needed. Dr. Martinez learned that Maria had been quietly studying during her off hours, taking online courses to update her medical knowledge and keep current with advances in trauma surgery. Despite having no realistic expectation of returning to surgical practice, she continued learning, driven by an intellectual curiosity and professional dedication that her injuries could not diminish. The revelation of Maria's true background created a moral dilemma for Dr. Martinez. Here was an extraordinarily qualified surgeon working as a janitor, her skills and knowledge going completely unused by the medical system. The waste of talent was staggering, but the bureaucratic and physical barriers to Maria returning to medical practice seemed insurmountable. Dr. Martinez began to understand why Maria had kept her background secret. The other hospital staff treated her as invisible, dismissing her as just another member of the cleaning crew. If they knew she had once been their professional equal or superior, the dynamics would become complicated and potentially uncomfortable for everyone involved. Maria had chosen anonymity as a form of protection, but also as a way to find peace with her circumstances. By accepting her role as a janitor, she avoided the constant reminder of what she had lost. She found dignity in honest work and purpose, in the small ways she could still contribute to patient care. As their shift ended, Dr. Martinez felt she had been given a tremendous privilege in learning Maria's true story. She also felt a growing sense of responsibility. The question that would haunt her in the days to come was simple but profound. What obligation did she have to help Maria? And what was truly in Maria's best interest? The night janitor gathered her cleaning supplies and prepared to leave, just as she had done hundreds of times before. But now, Dr. Martinez saw her differently. Instead of a simple cleaning lady, she saw a warrior who had fought battles most people could never imagine. Someone who had sacrificed her career and her health in service of others, and who continued that service in whatever way her circumstances allowed. Maria paused at the elevator, sensing that something fundamental had shifted in her relationship with Dr. Martinez. She had spent 3 years carefully maintaining her anonymity, and now that protective barrier had been breached. The question was whether revealing her truth would lead to positive change or simply create new complications in her already challenging life. Dr. Martinez watched the elevator doors close, her mind racing with possibilities. She had just discovered that one of the most skilled trauma surgeons she had ever encountered was mopping floors in her hospital. The injustice was overwhelming. But so was the complexity of the situation. What happened next would determine whether Maria's hidden strength would finally be recognized and valued, or whether it would remain buried beneath the assumptions and prejudices of a system that had failed to see her true worth. The night was ending, but for both women, a new chapter was just beginning. The quiet janitor, who had been underestimated by everyone around her, was about to face a choice that would force her to confront the past she had tried so hard to leave behind. Dr. Martinez could not stop thinking about Maria's story. Over the following weeks, she found herself observing the night janitor with new eyes, seeing not a cleaning lady, but a fellow physician whose skills were being wasted. The more she watched, the more convinced she became that something needed to be done to address this situation. The turning point came during a particularly challenging night in the emergency department. A multi-car accident had brought in several critical patients simultaneously, stretching the medical staff beyond their limits. Dr. Martinez was working on a child with severe abdominal trauma when she noticed Maria cleaning nearby, moving more slowly than usual due to her chronic back pain. As the emergency team struggled with one particularly complex case, Dr. Martinez overheard the attending physician expressing frustration about the patient's condition. The trauma was unusual and difficult to assess, and the team was having trouble determining the best course of action. Maria paused in her cleaning, her expression showing clear recognition of the medical situation being discussed. Dr. Martinez made a spontaneous decision that would change everything. She called Maria over, ostensibly to help move some equipment, but really to get her closer to the patient. As Maria approached, Dr. Martinez quietly asked for her professional opinion about the case, addressing her as Dr. Santos for the first time in years. Maria's transformation was immediate and remarkable. Her tired posture straightened, her eyes sharpened with focus, and her voice became confident and authoritative as she quickly assessed the situation. In less than a minute, she had identified subtle signs that the emergency team had missed and suggested a diagnostic approach that proved to be exactly right. The attending physician, Dr. Williams, was initially confused by the janitor's unexpected medical expertise, but as Maria's recommendations proved accurate, his confusion turned to amazement. When Dr. Martinez quietly explained Maria's background, the entire emergency team stopped what they were doing to listen. Maria found herself in the spotlight for the first time in years, and the attention was both thrilling and terrifying. She helped guide the team through the complex procedure, her knowledge and experience proving invaluable in saving the patient's life. For those precious hours, she was Dr. Santos again, doing what she had been born to do. News of the night's events spread quickly through the hospital. By the next morning, staff members who had barely acknowledged Maria's existence were seeking her out, amazed by the revelation of her true background. Some were embarrassed by how they had treated her, while others were simply fascinated by her story. Hospital Administrator Mr. Patterson was among those most shocked by the discovery. The woman he had criticized for being slow was actually an experienced surgeon whose careful work habits reflected medical training, not laziness. He found himself reassessing his entire approach to evaluating employee performance and wondering how many other hidden talents existed among his staff. The medical staff began consulting Maria informally about difficult cases, especially trauma situations where her specialized experience proved invaluable. Despite her official position as a janitor, she became an unofficial advisor to the emergency department, her insights helping to save lives and improve patient outcomes. However, the situation also created complications. Maria's dual role as janitor and medical consultant confused hospital protocols and raised questions about liability, credentialing, and proper procedures. The administration struggled with how to formally recognize her contributions while working within regulatory and insurance requirements. Dr. Martinez began researching options for helping Maria return to formal medical practice. She discovered programs designed to help foreign-trained physicians obtain U.S. licensure, including some specifically aimed at doctors who had fled conflict zones or faced other unusual circumstances. The process was complex and lengthy, but not impossible. Maria herself was conflicted about these developments. Part of her was thrilled to be using her medical knowledge again, to feel the intellectual challenge and emotional satisfaction of helping patients. But she was also frightened by the attention and unsure whether she was physically capable of handling the demands of formal medical practice. Her chronic back pain remained a significant limitation. While she could provide medical advice and guidance, the physical requirements of surgery or extended clinical work might be beyond her current capabilities. She worried about raising expectations she might not be able to meet, and about the potential consequences if her physical limitations led to complications. The hospital's medical board convened a special meeting to discuss Maria's situation. They faced unprecedented questions about credentialing, scope of practice, and how to integrate her expertise into their formal medical staff structure. Legal and regulatory experts were consulted to determine the best way forward. Meanwhile, Maria continued her janitorial duties, while also providing informal medical consultation. The dual role created a strange dynamic where she would spend part of her shift mopping floors and the other part helping to save lives. Her colleagues struggled to adjust to this new reality, unsure how to relate to someone who was simultaneously their peer and their superior. The story began attracting attention beyond the hospital. Local media picked up the tale of the surgeon janitor, and Maria's story resonated with people facing their own struggles with immigration, career setbacks, and hidden talents. She received letters from other displaced professionals who had found themselves working below their qualifications. Dr. Martinez worked tirelessly to help Maria navigate the complex process of medical recredentialing. She connected Maria with immigration lawyers, medical licensing specialists, and rehabilitation experts who could address her physical limitations. The process was daunting, but for the first time in years, Maria allowed herself to hope. The breakthrough came when the hospital's board of directors decided to create a new position specifically for Maria. They established a role that combined patient advocacy, trauma consultation, and medical education, allowing her to use her expertise without the physical demands of surgical practice. The position would provide a pathway toward full medical recredentialing while recognizing her current limitations. Maria's first official day in her new role was emotional for everyone involved. She wore medical scrubs instead of a janitor's uniform, carried a stethoscope instead of cleaning supplies, and introduced herself to patients as Dr. Santos, rather than Maria from housekeeping. The transformation was both symbolic and profound. Her new responsibilities included training emergency staff in trauma protocols, consulting on difficult cases, and serving as a liaison for Spanish-speaking patients and families. Her background in conflict medicine proved especially valuable in treating victims of violence, where her understanding of trauma extended beyond the purely medical to include psychological and social factors. The success of Maria's transition inspired the hospital to examine other overlooked staff members more carefully. They discovered a nurse's aide with advanced training in physical therapy, a cafeteria worker who had been a pharmacist in his home country, and several other employees whose talents had been hidden by language barriers, credentialing issues, or simple assumptions about their capabilities. Maria's story became a catalyst for broader changes in how the hospital valued and utilized all its staff members. New programs were established to identify hidden talents, provide professional development opportunities, and create pathways for advancement, regardless of an employee's current position or background. 6 months after her collapse in the hospital corridor, Maria stood before a group of medical students, sharing her story and teaching them about trauma surgery. Her back still caused her pain, and she would never again have the physical stamina for long surgical procedures, but she had found a new way to heal people and serve her profession. The quiet janitor who had been invisible to so many was now a respected member of the medical staff, her expertise valued and her contributions recognized. She had gone from being underestimated and overlooked to becoming an inspiration for an entire hospital community. Dr. Martinez watched from the back of the lecture hall, proud of her role in Maria's transformation but more impressed by Maria's own strength and resilience. The former surgeon had never really stopped being a doctor. Even when she was pushing a mop, she had simply found different ways to heal, different methods of caring, and different expressions of the dedication that defined her. Maria's journey was far from over. She was still working toward full medical recredentialing, still managing her chronic pain, and still adjusting to her new role and responsibilities. But she was no longer hiding her talents or accepting underestimation from others. She had reclaimed her identity as Dr. Santos while maintaining the humility and compassion she had learned during her years of hidden service. The hospital hallways that Maria had cleaned for 3 years now saw her in a different light. But she brought the same dedication and attention to detail to her new role that she had always shown. The wars she had fought, both literal and personal, had shaped her into someone uniquely qualified to heal, not just individual patients, but entire systems that failed to recognize the strength and value of those society often overlooks. In the end, Maria's story became proof that true strength is not always visible on the surface, that the most important battles are often fought in silence, and that recognition, when it finally comes, can transform not just individuals but entire communities. Her injured back had revealed not weakness, but the incredible resilience of someone who never stopped fighting to serve others. Even when no one was watching,